Sophie Quinn, student number N9440241. Alrighty, so I recently got called to a 77-year-old woman complaining of lower back pain. This woman had a history of chronic back pain and was on a heavy schedule of medication. On this morning, she woke up to her usual pain, however, it was worse than it had ever been before. It was not rating anywhere new, it had just increased in severity. And she was quite visibly upset and distressed. What I found challenging about this job was the extent to which we could assist this woman. Unfortunately, she had taken her medication, and the pain relief that QAS carry are similar to what she was already on, however at a lower dose. Even still, to try and make her more comfortable, we gave her morphine and some ondansetron as well. What I realised whilst doing this job was the importance of non-clinical treatment that is as essential as clinical interventions, in particular reassurance. A couple of months ago, I found myself in a situation where reassurance was absolutely vital when trying to calm down my niece who just sliced open one of her fingers. As I was at my family home, there was not much we could do in terms of fixing her finger. However, it became evident how significant comfort and reassurance can impact this situation. It involved not only trying to calm down my 2-year-old niece, but also my sister, who was obviously very upset. In this instance, I did not find it difficult to comfort my sister and niece. However, I feel this is because I know them. I think in a situation where it is a complete stranger who is often in a very vulnerable state, it will be a lot harder. Throughout this prac, it has become particularly evident, especially due to the number of people you see with chronic diseases, the relevance and importance of this non-clinical treatment. As these patients are often on a heavy regime of medications, it is not often necessary to treat them with more drugs, but to monitor them and have a conversation with them to provide support. Van Doorman, in the Journal of Evaluation in Clinical Practice 2011, state how reassurance is related to patients' better overall health. I feel this means building a good rapport with the patient to create trust so you can begin to understand their emotional concerns. Although paramedics have a short time with the patient, I feel it's still crucial to understand the whole picture of what is going on for the patient, as it can assist to provide an effective and accurate handover at hospital to ensure the patient's needs are being met. Furthermore, Rohert, Williams, McCaughey and Ishkidef in Health Expectations 2015 state that emotional support helps to considerably reduce distress and improve the overall ratings of care. They also point out the long-term benefits, particularly in chronic diseases that involve better management of their condition. By doing this, the advantages are copious. Even if in the time of transport, anxiety and distress levels can be lowered, it would prepare them for their hospital visit and ideally give them a more open mind to the help that they require. As I come to the end of my prac, I feel that the most important thing that I've learnt is to do with communication. And I feel it's something that comes with time and with experience. As I've said previously, being a paramedic has so much to do with conversing with the patient, as patients are often distressed, which adds to another challenge to overcome. It is incredibly relevant to my future practice, and I feel if I can begin to understand now how to communicate effectively and to provide emotional support, it will hopefully become easier and second nature for myself. Parnell in Health Literacy 2015 state, being empathetic, caring and looking at the situation from the patient's perspective can be helpful when building a respectful relationship. I feel this is extremely useful to keep in mind, as factors such as impatience and fatigue from the paramedic side can impact the way in which you communicate with a patient. And it's important to remember that even though it may be the 6th patient of the day, it is their first time that day calling the ambulance. Additionally, O'Hagan in Journal of Advanced Nursing 2013 point out the importance of non-verbal communication to provide emotional support. So this includes eye contact and touch. By exploring these ideas, it shows me how much there is to consider when having a conversation in order to convey reassurance, and not only gives the patient comfort, but also helps in the long run, as they are more likely to disclose information to paint a better picture for their health.